Good afternoon. Thank you to Assemblymember Wood and to the committee for hosting this hearing on this important topic of healthcare affordability. My presentation today will focus on the available research and data on the impacts that healthcare affordability has on California workers, consumers, and employers. Next slide.
Is there a way on our end to turn that up so we can hear it a little better? Okay, go ahead. We'll see how this goes.
I can't see the slide, so I'm not sure if we're on the right
We are on the
slide.
first
We should be on slide 2.
We're on the slide that says certain healthcare affordability concerns. How's that?
Great, thank you. So in late 2019, the California Healthcare Foundation sponsored a survey that found that more than 2/3 of California adults reported that they were very or somewhat worried about unexpected medical bills or affording their out-of-pocket costs when accessing healthcare. This was a higher percentage than the 54% who said they were very or somewhat worried about affording their rent or mortgage. I think this puts into perspective how dire healthcare affordability concerns have become for Californians. In addition to being worried about unexpected medical bills and out-of-pocket costs, half of adults said they were worried about prescription drug costs, and more than 4 out of 10 who had health insurance were worried about affording their monthly premiums. Next slide, please. Using the same survey, we see that healthcare affordability concerns are even more common among Hispanic, Black, and Asian California adults than among white adults. Next slide, please. While healthcare affordability concerns are too common across all income groups, low-income Californians and households with income below twice the federal poverty level were more likely to worry about healthcare affordability than their counterparts who earned more. Next slide, please. These affordability concerns mean that people aren't getting the care they need at the time they need it. Many Californians are skipping prescriptions or cutting pills in half, skipping recommended tests or treatments, postponing needed medical care, whether that's physical health care, mental health care, or dental care. And over half of California adults experienced at least one of these access to care problems due to affordability. In addition, healthcare affordability concerns have financial consequences, such as people cutting back on other basic necessities, taking on debt, and even in some cases declaring bankruptcy. Next slide, please. Healthcare affordability is an issue that affects nearly all Californians, but today my presentation will mostly focus on the majority of California adults who have coverage through their own job or a family member's job, and the 11% of California adults who have coverage through the individual market. But 2 other groups I wanted to highlight that particularly face affordability challenges due to high and rising healthcare costs are uninsured Californians and those enrolled in Medicare. Turning to job-based coverage, 2 slides ahead, please. Together, California employers and workers spent $144 billion on covered healthcare benefits in 2019. That's equivalent to approximately 5% of our state's economy. This spending included $44 billion that workers paid in premiums and other cost sharing. And I'm going to talk more in a minute about the consequences of this worker spending and how it relates to the spending by employers. But first, I want to address the $100 billion that employers spend on premiums each year, including $5 billion that the state spends on health benefits for state employees who get their coverage through CalPERS. California employers are spending this $100 billion each year in a market that's broken in a lot of ways, which we've already started to hear about in this hearing and which I think we'll be hearing more about. Healthcare costs are growing rapidly and without a clear and corresponding increase in the value received. Healthcare purchasers often lack good information about what they're buying. Healthcare markets in the state are highly consolidated and often lack competition, not only leading to higher prices, but also large variation in prices that doesn't necessarily have a corresponding variation in quality or outcomes. A lot of large employers, including CalPERS, have taken steps to try to bend the cost curve with some success, but their ability to control costs is constrained in our current system. Even the largest companies in this state have often hit roadblocks in attempting to try to ensure the highest value for their healthcare spending. For small employers, the challenges with purchasing health benefits on behalf of their employees are even greater. Next slide, please. In 2018, the average total premium for family health benefits in this state exceeded $20,000 a year. As Kaiser Family Foundation puts it, that's equivalent to buying a new car every year. For someone working 40 hours a week, that's equivalent to $10 an hour on health benefits alone, which is an amount that approaches the minimum wage in this state. So healthcare is a big part of workers' total compensation. And when employers make decisions about how to address rising healthcare costs, they're generally thinking about their response in the context of overall compensation, including wages, retirement, paid time off, and other benefits. Next slide. Premiums are not only high, but growing rapidly. Average family premiums have grown by almost 50% over the last decade after accounting for inflation, while wages for the typical worker have essentially remained flat after accounting for inflation. It's difficult to isolate the effect that rising healthcare costs alone have had on wages compared to the other factors that affect wages. So this graph is not to necessarily say that wage stagnation is solely due to rising healthcare costs, but there has been research showing a connection between rising healthcare costs and wage growth that is slower than the wage growth that would have otherwise have occurred without rising healthcare costs. I'm going to skip ahead a couple slides to slide 13 in the interest of time. Thank you. One example of this type of research is a national study that was co-authored by one of the experts that will be testifying later in this hearing, Christopher Whaley. This national RAND study found that hospital mergers over the 2010 to 2016 period led to a $521 increase in hospital prices and a similarly sized increase in hospital spending among people with private insurance and a similarly sized reduction in wages. Next slide. In addition to having an impact on wages, another way that employers have responded to rising healthcare costs is by increasing how much workers have to pay out of pocket when they access care. This graphic shows that over the last decade, the percentage of Californians who have a deductible as part of their job-based coverage has increased to 46%, which is still lower than the national percentage of 82% with the deductible, but it's still growing. And importantly, the deductible amount for people who have a deductible has nearly doubled over the last decade to $1,400. And a deductible is just one measure of cost sharing that's relatively easy to track over time, but people who don't have deductibles have also seen an increase in their cost sharing as well. An ability to afford out-of-pocket costs in healthcare is not only driven by healthcare prices, it's also tied in with the larger problems of income and wealth inequality in this country. As one example, the Federal Reserve estimated that 40% of American adults don't have $400 in savings to use in an emergency. And that really helps put the $1,400 deductible in context. Next slide. So given that the ACA is at risk again, I wanted to highlight that overturning the ACA would only make matters worse for those with job-based coverage, both in terms of eliminating important protections on out-of-pocket spending that benefited people with job-based coverage, and also in terms of the coverage expansions under the ACA. Many California young adults are able to be on their parents' job-based coverage as a result of their ACA, as a result of the ACA. And the major ACA coverage expansions, the Medi-Cal expansion and subsidized insurance through Covered California, are a really important protection for people who have job-based coverage in case they lose that coverage or lose their job. 2 slides ahead, please. Slide 17. Turning to the individual market, there are 2 different groups in that market that are affected by cost growth differently. For the more than 1.3 million Californians who get their insurance through Covered California with ACA or state subsidies, those subsidies improve premium affordability significantly, bringing an average premium of $582 a month down to an average net premium of $127 after subsidies. Because of the way that the ACA and the state subsidies are structured, these enrollees are protected from their premiums increasing in accordance with cost growth. But there are another nearly 1 million Californians who purchase coverage through Covered California or directly from an insurer without subsidies. And these enrollees' premiums are directly affected by underlying cost growth. And their premium growth averaged 6.3% per year in 2015 and 2021, though in the current year and next year, premium increases are less than 1%. Next slide, please. Even though subsidized enrollees are largely protected from cost trends in terms of their premiums, they are not shielded from growth in out-of-pocket costs. This graph shows that for the silver plan in Covered California, which is the benchmark plan, the maximum out-of-pocket limit has grown by 29% since the start of Covered California, and the medical deductible has more than doubled. And these growth rates are a reflection of healthcare costs growing more rapidly than the federal poverty level and then compared to California inflation. The ACA did set standards for the share of costs that an insurer pays across an average population for a given plan level. For example, insurers pay 70% of costs on average in silver plans, and consumers pay the remaining 30% through cost sharing. But when underlying medical costs are growing rapidly, the consumer's share of costs also grows rapidly in absolute dollars. I want to note here that most consumers don't reach their deductible or their out-of-pocket maximum, but these are examples to illustrate the growth in exposure to out-of-pocket costs over time. Next slide, please. A 2017 survey of California individual market enrollees showed that a substantial fraction had difficulty paying their premiums and out-of-pocket costs, and that was true across the income spectrum. This survey was done before the state subsidy program that began this year. Like with job-based coverage, these affordability concerns in the individual market translate to barriers to care and financial difficulties. Next slide. So to summarize, California adults have expressed a high degree of worry about healthcare affordability, and those worries are more common among Black, Latino, and Asian Californians and low-income Californians. Healthcare affordability concerns can hinder access to care and cause financial hardship. California workers and employers spend a tremendous amount on job-based coverage each year, and premiums have been growing more rapidly than wages and inflation. These trends have contributed to wage stagnation and rapidly increasing and have rapidly increased the exposure to out-of-pocket costs over the last decade. In the individual market, unsubsidized enrollees face the full risk of rising healthcare costs, while subsidized enrollees are largely protected on the premium side, but face the full impact of rising healthcare costs in terms of their out-of-pocket costs. Thank you again for the opportunity to participate in this hearing.